Scotland is now 4 years into what its former First Minister Nicola Sturgeon called a drug death public health emergency. Now the City of Glasgow is trying a radical new solution by opening a drug consumption room. It aims to provide a safer environment for people to take drugs in the hope of reducing deaths. So can this reduce Scotland's high rate of drug-related deaths? Well, I'm Charlene White, and this is what you need to know. Welcome to our latest quick briefing, where I'm joined by our correspondent, Peter Smith, who's been looking at this issue for quite some time. Thanks for joining us, Peter. Can you explain to us exactly what a drug consumption room is?
Yes, well, it's a concept that falls under the remit of what would be called harm reduction. So it's essentially about saying people are using drugs anyway. The war on drugs, about trying to eradicate drugs from our streets, is evidently not succeeding. So if people are using drugs anyway, what can be done to try and reduce the harms that they're doing to themselves and to communities that they are in? And that involves essentially these drug consumption rooms creating a safe, clean environment for them to bring their drugs, or in some countries around the world where they would be prescribed the drugs at location that they'll be using. They'll be provided with clean equipment to inject. Again, in some drug consumption rooms around the world, they'd be smoking drugs as well, or snorting. And they're given that clean environment, the clean equipment. They would be under supervision of a nurse or healthcare professional. If they experienced any health complications, like an overdose, then there could be an attempt to resuscitate them, and that's been really effective. There have been really few deaths in drug consumption rooms around the world, despite thousands of people who have been using them over a long period of time. So if people are experiencing an overdose, it can save lives. Also, if people are injecting into wounds and whatnot, that can be identified. They can be treated for that. It can save people's lives. It can save limbs, and it also stops the spread of bloodborne viruses. It's there's evidence that it's reduced the spread of HIV in some places because it's prevented needle sharing. The needles are given clean needles, they're disposed of safely afterwards. And so that's essentially what we have. The UK's very first drug consumption room, a place where you can take your drugs and you will not only be given a free pass, you'll be actively encouraged to go there to take your drugs under supervision, with the idea being it will be safer for the drug user and the community around them, with fewer needles discarded in public areas.
Yeah, I mean, you've talked us through many of the positives of this, but there surely must be some negatives to this idea as well, though.
Well, there would be people who would take a very different approach to what should be done about tackling the issue of drugs. And, for example, Scotland's drug deaths public health emergency, which, as you'd mentioned, was declared 4 years ago by then First Minister Nicola Sturgeon. People are saying, well, if you just give people somewhere to take their drugs, yes, it's in a safe environment. It ignores some of the what we could call more holistic problems around that. It ignores the mental health crisis. It ignores the fact that people are in many cases using drugs because they have mental health, they're experiencing a mental health crisis, or they have mental health problems that they're unable to be treated for. They're self-medicating, and if you're not, if you're just giving them a place to take their drugs, that's just, kind of treating the symptoms. You're not actually getting to the core of the problem. Also, if you don't give people an opportunity to access other services to get better, for example, like rehabilitation beds, where they could, if they wanted to, come off drugs altogether, then all you're really doing is giving them a place where they can continue a harmful, self-harming habit until they're no longer with us to do so. And in that case, you could say, well, that's not providing people with hope. That's just kind of prolonging people's pain. So there are people who would take a different approach and say that there should be more effort put into getting people better, getting people off drugs.